welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and let's look into today's reports. Rare case of isopropanol poisoning through transdermal absorption delayed by dialysis. Isopropanol poisoning is the most often reported hazardous alcohol consumption and emergency physicians are well aware of it. The majority of toxicities are caused by unintended ingestion of rubbing alcohol. Nevertheless, transdermal absorption is an under-recognized form of unintentional toxicity. Furthermore, hemodialysis effectively eliminates isopropanol and its metabolites from circulation. Thus, toxicity can be delayed in individuals getting frequent hemodialysis. A recent case study published in the American Journal of Case Reports describes the case of unintentional isopropanol poisoning through transdermal absorption, which is delayed by weekly hemodialysis in a 67-year-old lady. The report emphasizes the need of increasing the emergency department doctors' understanding of this route of toxicity, as well as public education on the proper indications and the safe usage of topical alcohol application. Low-carb diet may decrease the risk of metabolic syndrome in prostate cancer patients. A reduced carbohydrate diet has been demonstrated to inhibit the progression of prostate cancer. Low carbohydrate diet improves metabolic syndrome without causing weight reduction in non-cancer individuals. However, worries concerning the deleterious influence on the risk of cardiovascular disease still remain. A new study has found that a low carbohydrate diet has resulted in a considerably decreased risk of metabolic syndrome and residual cholesterol, as well as significantly lowers the predicted cardiovascular disease risk using the BMI index. By contrast, there was no difference in predicted risk when lipids were used. Given the recognized cardiovascular hazards of androgen deprivation, decrease in metabolic syndrome may be a significant objective in men having advanced prostate treatment. Low carbohydrate diets was found to be a positive association itself with the risk of metabolic syndrome and other cardiovascular diseases. Hyaluronic acid injections have increased for knee arthritis despite recommendations against their use. Knee osteoarthritis is a very common condition and leading cause of disability in older adults. Hyaluronic acid injections are given with the aim of reducing the pain and improving the functioning by supplementing the fluid within the knee joint. However, as reflected by the 2013 American Academy of Orthopedic Surgeons guidelines, available evidence does not meet the minimum clinically important improvement thresholds for patients with knee osteoarthritis. For Medicare beneficiaries with this condition, the use of hyaluronic acid injections has increased in recent years, despite clinical guidelines recommending against the use of this treatment, as reported in a study in the Journal of Bone and Joint Surgery. Adolescents benefit from suicide prevention videos. Youth suicide is a major public health problem in many countries and ranks consistently among the 3 most common causes of death among young people or even adolescents. Consequently, considerable attention has been given to how the youth suicide might be combated. One promising intervention path is media interventions. Suicide prevention videos featuring young people's personal narratives of hope and recovery are increasingly used in suicide prevention, but research on their effects is, however, scarce. Adolescents appear to benefit from suicide prevention narrative videos, according to a recent study published in the European Child and Adolescent Psychiatry. The researchers concluded that adolescents appear to benefit from suicide prevention narratives featuring personal stories from peers on coping with suicidal ideation and help seeking. Thank you and stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.